Okay, so today we're going deep on something you sent in.
Okay.
It's a tribute to a medical professor, Dr. R.S. Mehta,
Hmm.
written by one of his students, Dr. O. Farishta.
Interesting.
And what really caught my eye was just this idea of a brilliant clinical mind,
Right.
but also somebody who had a very,
Theoretically.
let's say, spirited temperament.
Yes.
And, you sent this in and you were wondering,
Yeah.
what made him such an impactful professor beyond just,
Beyond just the medicine.
the medical knowledge?
Yeah, absolutely.
Yeah.
And what's so cool is like right away, Dr. Farishta doesn't just give us a dry, biography or whatever.
Right.
He gives these like really vivid little stories and descriptions.
Yeah.
Like, for example, he talks about Professor Mehta's voice
Oh,
booming through the hallways of the hospital.
Uh-huh.
And like, these pronouncements like,
Yeah.
where's your posting? Why are you loitering here?
Oh, wow.
Like just these incredible lines that would just like freeze people in their tracks.
You can just imagine being
Oh, yeah.
a med student
Totally.
and hearing that.
Oh, my God.
But beyond those hallway pronouncements, I love how he focuses on two specific
Right.
bombshells, as he calls them.
Yes.
Two really key moments. And these aren't just, funny stories. These are really turning points.
Right.
So let's start with that first one, outside the Indian coffee house.
Okay, so picture this, the Indian coffee house, classic student hangout.
Yeah.
Professor Mehta drives by in his, trusty old Fiat.
Yeah.
And he sees Dr. Farishta, gossiping with his friends.
Right.
Classic student stuff, right?
Totally.
So what does he do?
Yeah.
He rolls down the window
Uh-huh.
and he shouts this line.
Oh, yeah.
Apan Aka, life yahi waste karega kaya.
Oh.
Which means, will you waste your whole life on this?
Wow. What a...
Pretty brutal.
Yeah. It's intense.
You would think that would just be like mortifying.
Yeah, you'd think that'd be it.
But here's the thing.
Yeah.
Dr. Farishta says that one shout like sparked something in him.
Right.
He went on to earn the gold medal in medicine.
Wow.
And he never set foot in that coffee house again.
That is wild.
Talk about a wake-up call, right?
Yeah.
So, for anyone listening,
Yeah.
have you ever had like a comment like that that just totally changed your direction?
A seemingly harsh comment
Yeah.
that actually put you on a better path.
It's so interesting, right?
It's really interesting.
Like sometimes a really direct challenge
Right.
can be so much more effective than just, encouragement.
I think it's true.
Especially when it speaks to like your ambition or something.
Yeah, yeah.
There's clearly a catalyst.
Totally a catalyst.
Yeah.
Okay, so let's get into that second bombshell.
Okay.
This one happens after Professor Mehta has moved to indoor, years later.
Years later.
Dr. Farishta gets a call from a longtime patient of Professor Mehta's, Mr. Chabria,
Okay.
who relays a message that he should call the professor. So Dr. Farishta calls him.
And the conversation,
It gets right to the point.
it is very direct.
So Professor Mehta's first thing he says is, Apan, MD, Karne, Kebad, Padna, Wadna Chud, Dia Haiki.
Oh my gosh.
Which means, have you stopped studying after getting your MD?
Wow. So blunt.
Yeah.
And then when Dr. Farishta is like, no, I'm still learning.
Right.
Professor Farishta is like, okay, good.
Uh-huh.
Mr. Chabria is not doing well.
Right.
And then he just says ranolazine.
Ranolazine.
Ranolazine, which is a relatively new medication
Yeah.
at the time
Right.
for treating like severe chest pain related to heart issues.
So this is already showing you how on top of things this guy was.
Like cutting edge medicine, right?
Yeah. And then here's the real kicker, right?
He hangs up.
He hangs up,
Nothing.
doesn't say goodbye, nothing.
Nothing.
That is so...
And that says so much.
It does say so much.
It forces Dr. Farishta to do his own research.
Totally.
Which is, of course, what Professor Mehta wanted. So he goes and he looks it up.
Yeah.
And he realizes
Yeah.
that his current edition of Harrison's textbook, the standard medical textbook,
Yeah.
doesn't even mention ranolazine.
Right.
So then he's like, okay, maybe I need to update this.
Right.
So he gets the newest edition,
Uh-huh.
and lo and behold,
Yeah.
there it is.
15 days old. The edition is 15 days old.
15 days.
And this guy already knows about it and is using it to treat patients.
That's incredible.
That is a real commitment
to
to...
staying on top of things.
Yeah, and it wasn't, it wasn't a reprimand. It was a demonstration.
Exactly.
This is how important it is.
It's not just about knowing the basics.
Yeah.
It's about constantly pushing forward.
So what does this all mean?
Yeah.
What does this tell us about Dr. Mehta?
I think it goes beyond just this one professor, right?
Totally.
This tribute from Dr. Farishta.
Yeah.
It shows us the impact that a mentor can have
Yeah.
and the importance of continuous learning.
Like in any field.
In any field,
Yeah.
whether you're a doctor or a
Podcaster.
podcaster,
Whatever.
you've got to keep learning.
You always have to be learning.
It's so true.
And I think what's also interesting is that mentorship isn't always, gentle guidance.
Right.
Sometimes it's a shock.
Right.
Sometimes it's a challenge
It's that jolt.
that pushes you to grow.
Yeah, and I think that's what we see with Dr. Mehta.
Totally.
So for everybody out there listening, think about a time when a comment,
Yeah.
maybe a seemingly harsh comment,
Yeah.
actually helped you.
Pushed you in a new direction.
Yeah, made you change your understanding of something.
What was it about that moment
Yeah.
that made it so impactful?
What was it about that jolt that really pushed you to change and grow?
It's fascinating to think about.
It really is.
It really is.